Surgery in Hospitals in the Industrial Revolution poem. So it's a poem about changes to surgery in hospitals between around 1700 to around 1900. It's linked to the history of medicine in Britain for GCSE. 18th century medicine was ghastly. By 1900 it had improved vastly. From amputees screaming whilst under the knife to anaesthetised patients with more chance of life. From pus-covered aprons spreading infection to aseptic surgery offering protection. Hospitals too went through great change. Florence Nightingale did rearrange. The Turkish hospital of the army, suffering death rates that were balmy, she got her nurses to mop and clean, while engineers built a new latrine. Flow's impact was, it seems, quite drastic. Survival rates became fantastic. Sanitary commissions helped as well. The Crimean War became a lesser hell. Also helping out was Mary Seacole, giving nursing and treats to keep men whole. Nightingale went on to bring more progress, her fame cemented by the news press. The lady with the lamp made nursing skilled, meaning fewer hospital patients killed. She even worked on hospital design, where all the floors could be made to shine. The beginning of the industrial age saw surgery at a basic stage. No painkillers were given out. Knives and saws made patients shout. Speedy work was of great import, thus patient lives were often short. Anaesthetics turned up on the scene. A painless future could be seen. Ether first, but it had its flaws, explosive stuff that did coughing cause. Then Simpson discovered chloroform, taking the surgical world by storm. Yet chloroform was also risky, made from bleach mixed in with whiskey. Too high a dose could quickly slay. This caused John Snow much dismay. So a new safe method he did tailor, the John Snow type chloroform inhaler. The risk of pain had been defeated, yet death came to those the surgeons treated. Surgery's black period had now come, as to infection most did succumb. Surgeons could now take their time, with their surgeons' coats besmeared with grime. Infection risk just was not known, so dirty knives and saws for bone were quickly whipped with little fuss, so no fear was felt for blood and pus. Until Pasteur made the connection, germs were causing wound infection. Pasteur's work was read by Lister, who developed his carbolic acid mister. He knew the acid killed off germs. The lack of death his work confirms. Cleaning wounds and equipment with antiseptic began to convince the filthy skeptic. In theory, the problems of surgery had ended, yet many a surgeon instead felt offended. Some preferred their patients to scream, others contested the need to be clean. Aseptic surgery became the rule. The surgical option was no longer cruel.